And you've listed a whole variety of ways in which you have engaged, which is good to see. And we can certainly say that we've seen a number of your posters and billboards throughout the borough. Face-to-face meetings with a range of community groups and hard-to-reach groups is something that you've touched on here. And what concerns me is that Old Oak Estates and Old Oak Children's Centre and Old Oak Community and Children's Centre is a stone's throw away from Hammersmith Hospital. And there's been no engagement at all, actually, with that community centre, which hosts a whole range of groups and services. And, you know, this is certainly something that I am well aware of. And, you know, it's ridiculous, ultimately, that engagement hasn't taken place. And this is the most deprived ward in the borough, and it is in the wards where Hammersmith Hospital is located. So that really does concern me. So my question is, I suppose, how many face-to-face interviews were conducted, and who were these groups? And just to add to that, at the last meeting we had, I did ask for a list of all of the stakeholders and all of the groups that you were going to engage with, and I hadn't seen that list. That was an opportunity really for us to really add to that list and to help support that engagement process. To make sure that you are reaching the hard-to-reach groups. So that's a major problem that we need to understand. I'd also like to know how many people presented themselves to Hammersmith Hospital with the changes to the service, and what those numbers look like compared to, obviously, previous months where they were able to present and have a service provided.
So on the list of community groups, I think that we send you a list of them all, and it's in your notes as complete that we did it, but we can do it again.
I will double check.
If we haven't been to that community centre in Old Oak, then we're very happy to go and talk to them. I'm sorry if we didn't get there the first time round. In terms of the focus groups, there are the normal way of doing a representative sample of the population, but we've also asked now 1,500 people about their understanding of the changes that we have made, and it is clear that the more people we're asking now, the more they understand compared to people we asked a few weeks ago. I think we're quite encouraged by the level of awareness, particularly the residents of Hammersmith and Fulham. We have definitely been more successful at communicating with residents in Hammersmith and Fulham than we have in Brent. There's learning. There's learning for us there, I think, about what's worked well and what hasn't. And I think one of the things we're really pleased about is the number of people attending the urgent care centre at Hammersmith has not decreased. We were worried that people would not think there was a service there 24 hours a day, 7 days a week, and all go to St Mary's. And had that happened, I think our planning wouldn't have worked, but the good thing is that the people who we thought should attend are attending, and the people are selecting well to go there because the number of people who you have to transfer from Hammersmith Urgent Care Centre to a full A&E is very low, and is much lower than we had modelled ambulance capacity being needed for. So broadly, I'd say we think we have communicated well, we think the public have understood what we have said, and they're using good judgment about where to go to get urgent care.